Good afternoon, fielders. How are you? Good to see everybody. Just got to my desk, so actually, I've been here since about 6 o'clock this morning. But I figured this is a good time to log in to uh, check in with everybody, see how everybody's doing, and answer some questions for you. So if you have questions, put them into the comments, fire away, and let me know what I can help with today. I think it's going to be, this is probably a good day that's a little bit calmer than yesterday. Yesterday was a little crazy. So hopefully we can answer some questions. I see Diana from the PTC has joined us. So I told her that we talked yesterday, and she said she would be in the group. So we can answer some questions from my end, from PTC's end. So if there's anything you guys have, shoot away. I tried to answer some questions in the group as we went by. A couple of questions came in that were very specific to things that people were looking for that had nothing to do with the Facebook group. A lot of people were concerned about unemployment and things like that. I referred people who were asking those questions to some of the other groups, some of the practice management groups, office manager groups that have some of those I'm hesitant to say answers because I don't know that those are necessarily the correct answers, but there's some information out there. I like to try to get as much fact-based information in this group as possible and not just make it into, rumors all day long. So if you have questions that I might be able to help you with, put them down in the comment field in the chat, and fire away. We'll answer what I can, and we'll see how we can do this. One of the great questions that came in from Tanya earlier today was about in the downtime. What are some of the cleanup things that can be done? And one of the things I always talk about is cleaning up inactive patients, inactive employers, inactive insurance companies, working on fee schedules, working on coverage books, so that when we get back up to full speed, we are able to get lean and mean. It's going to be really, really important for small businesses to be able to be on top of their game, to be able to collect co-payments so that their cash flow is back up and moving. So if you do get those coverage books and or fee schedules in your system, the minute you're back up and running, you're going to be able to walk out a patient, give them a true estimation of cost, and collect at the time of service, so that we are above board. We're getting ahead of the curve. So, and that's why I keep saying it, and I keep seeing people do this. Anybody who has a notice that says that your office is closed, please, please, please change the wording. You're not closed. You're not seeing patients at the moment. You're still working. Obviously, if you're in this group, you're still working. So stop saying that you are closed. It's the scariest thing in the world to hear that a business has closed. Stop using that word. Hey, Nicole. Hey, Dawn. Good to see you guys in the group. But please stop saying you're closed. You guys are in the office working, only available to emergency patients. I'm working on a something that one of the universities just put out that shows what an emergency is. And please, if you are available, which I know that all the dentists who are in the group are available to their patients, either as just a phone call, as I'll call in a prescription for you, or, hey, I'll meet you at the office. We're going to get gloved and gowned up, and I'm going to insert this crown because your temporary came out. You're there for your patients. So stop saying you're closed. All right. Any other word works, but closed is a bad word. If you want to get back up and running when we're back in business, stop saying you're closed, please. Anyway, let me get off my soapbox for a minute. So if there are questions that I can help with, throw them out there. I on a daily basis, I work with practices that, from 2 chairs to 26 chairs, from people who are just barely scratching the surface of utilizing the software, up to fully utilizing it, using every single checkbox in Eaglesoft. So if you have questions, anything I can help with, I'm happy to help with. And there's some, remember, in the group is not just me, even though my name's on the masthead. There's some great experts in the group who should be able to help. Usually if you see me not answer a question, it's because I don't have a good answer, and it'll probably come from somebody else. So if you have questions, throw them out there while we can. It looks like we've only been live for 5 minutes, and we got 30 people in the group. So if you've got questions, throw them out there. Nicole, hello from Mitten. From the Mitten. Okay, but Nicole, where are you on the Mitten? Because I learned that in Michigan, you got to say where you are in the Mitten. So I got to figure out where you are, or okay, the Mitten plus this part over here. So where are you on the Mitten? So thank you guys for being part of the group. I always appreciate it. And let me know what I can help with. It's been a really confusing couple of days. Some of the dental societies, dental associations weren't really clear. Thank God that the Louisiana Dental Association just basically said you are forbidden from seeing patients on a routine basis, only for emergencies. At least they were straight up and honest with it. Hey, Shannon from Georgia. Martinez, Georgia. Now I got to go to Google. I got to find out where that is in relationship to some of the other places I've been. I get around a little bit, and I always wonder when I see towns like where they are. I'm a nut about that. If I'm talking to somebody from any place, I'm always looking up where something is on the map so that I can get an idea. And half the time, usually I've been driving through that town at some point in my life. So, I know where that is. You're near Augusta. Okay, cool. So, glad you're in the group, Shannon. Anybody else have any questions that you want? I am looking at all of my social media. Yesterday when we were doing, I guess it was 2 days ago, we were doing this Facebook Live. I was getting questions through Instagram, through Facebook, through everything else. So let's see. We're looking into putting together some remote Eaglesoft training opportunities to help with staff training during this downtime. Awesome. And if you guys didn't notice, you see Diana just posted in the chat. Diana is one of the heroes at the PTC, and you can see right there, she is, the PTC is putting together some opportunities for staff training during this time period, and they'll post some information in the field guide when it comes up. Awesome, thank you for doing that. Yeah, Shannon says where the Masters tournament was. Yep, as soon as I saw Augusta, I figured that must be. So glad to see you there. Hindra, is there an Eaglesoft support we can utilize for handling or rescheduling? Our staff is laid off and doctors only seeing emergencies. So are you asking, is there somebody at the PTC who could actually dial into your computer and help with rescheduling? I don't know that that's necessarily something that the PTC would do. I think that would be something that you might want to reach out to some of the virtual management companies do. Practice Mechanic, who are good friends and sort of right up the road from me. Rick Garofalo, who's in the group. Rick's company does that. eAssist, DSS, Dental Support Specialties. Those are the kind of companies I would reach out to do that kind of stuff. Other than that, I would say that's something that has to be done in-house. I don't know that's something that PTC would be doing. So, Anne-Maria, hopefully that answers your question. Let's see, Ashley, insurance companies' phone lines are still lines have no wait. So great time for staff to call in and get information. I agree with you. This is actually perfect, exactly what I'm talking about. This is the time to work on clearing out those bad employers, bad insurance companies, updating your fee schedules, putting those service types in there that I talk about all the time so that you can clarify plans so that when you get back up to speed, you are nailing it when it comes to estimation. So your patients are really clear. So you utilize this time to retool your practice and get lean and mean and ready to go. Even, some people have been saying, well, my staff's not here, it's just the doctor. Hey, doc, this is the time to learn the software. Take some of look at some of the how-tos in this, the group, and learn your software. If it's just you, time to do it. Or you know what, maybe this is an opportunity to be able to pay somebody to come back into the office to do that if you had to do layoffs or whatever, as long as you're not affecting benefits. Rochelle, yes, that's where I've been working this morning. Yeah, good. Thanks, Rochelle, for doing that. Exactly what we're working on. You're welcome, Anne-Marie. Okay. Hi from New York City. Hey, let's see. My office is fee for service, and my doctor has always requested. We have treatment plans printed out with zero estimations. We have never utilized coverage books or the like. Should we be doing that, or how do we present that idea? If you don't, well, here's the deal. And you'll see my explanation in the field guide on this. I think you have three different ways of practicing. You can be a practice who estimates insurance and say, your service is $100. We estimate that the insurance is going to cover 80, and you pay us $20 today. You can be a practice where you can say, we will accept your insurance, but we have no idea what the coverage is, so pay us a whole amount and you'll get an insurance check. Or you could be an office where you can say, your visit's $100. We estimate, we're really not sure, but it's about $80. Give us 20, and if there's a difference, we'll send you a bill. If you are outside of all of that and you just say, I have no idea, we don't even put anything on our estimations, it's zero, just pay us in full, and you deal with your insurance later, stay that way. That is, you're a unicorn in the world of dentistry, and stay that way if you can. I would say, the minute you step your toe in the pool of insurance, you are wet. So, don't go there if you don't have to. But if you can do that, do that. Where are you in New York? Post it back. I'm trying to see what things are like. I've got a house or an apartment in the city, but I haven't been up recently, and I was wondering what the city's like. I have no intention of going to the city at the moment, but just wondering. Good. Okay, so Diana did answer your question. We don't have anything in place to assist with patient scheduling for our customers, but it's certainly an idea that we can look into. Yep, it's a great idea. The craziest thing is, you really have to know the ins and outs of the practice in order to be able to make those changes in your schedule. So it's a great idea. And that's why, not that this is a advertisement for a practice mechanic, but I spend a day every year working with the staff at the practice mechanic on customer service skills. Getting those people so that they know how to take care of your customers as they deal with customers. So, it's a great thing to do that, but you really have to be up and running to train to do that. So. Again, anybody who has any questions, post them. I'm answering questions here. If you see in the chat, Diana is in the chat from the PTC. Diana and I have worked together for as long as I've been associated with Eaglesoft, and she's in the group fielding questions too. I saw as I could see people logging in that we've got some TAs, certified technology advisors in the group too. So any questions that you guys have, post them away, and let's see how we can help get through this information. There's about 30 people in the chat now. I'll go until I've got a 2:30 telephone conference, but I'll try to go as long as I can. So let me know what I can do to help. One thing I will tell you is be very leery of some of these people who are posting get rich quick things. And I've blocked about 5 people that I had no idea they were in the group until they started trying to spam people with things. People are selling all kinds of crap online. Debbie, miss you, man. Good to see you. First thing I thought about when this started happening is maybe I should go to Orange County and hang out with Debbie and get away from all this, but I guess I can't get too far enough to get away from this stuff. So good to see you. Hope you guys are doing well. And Melita, good to see you. Melita's right down the road from me, Doc. I haven't seen you in a while, but good to see you in the group. My sound is on. Hopefully everybody can hear me. If you can't hear me, put your hand up and say you can't hear me. I got a $1 million mic sitting here next to me, so hopefully you guys can hear me. Okay, what's the most underutilized tool we can use in Eaglesoft that will help us working on insurance AR? Okay, so one thing I was thinking about is maybe instead of doing a Facebook Live, that maybe we work on a Zoom call, because Facebook Live, I can't show you Eaglesoft, but maybe if we do a Zoom call, maybe I can even schedule that. I've got to figure out, I have to look at my schedule. But for insurance accounts receivable, I think that's a misnomer. I don't think there's, insurance is like your dad telling you that he owes you $10. I mean, it's your dad. You should be able to get $10 from your dad. There should be an accounts receivable with your dad. You submit a claim. There should be money that comes to you. If the money doesn't come to you, you close the claim out and send it to the patient. So what I would tell you is, hey, can I get Eaglesoft on the phone? Somebody's asking me a question. I can't answer that while we're going through this. But if you just go to your main Eaglesoft screen, the practice management screen, the front desk screen, you click on the claims button. All right. And in that claims button, you're going to see columns. One of them is the age of the claim. If you click the header, the title of that column twice, it will sort the claims by age. Anything that's over 45 days, you need to deal with. I don't believe in a whole lot of printing outstanding claims reports and all that crap. It's just a paper. I want to see it on the screen. I want to be able to right click and find out who the insurance company is and get on the phone and call them or resubmit the claim or whatever needs to be done. But I'm not a big fan of printing reports and looking at all that stuff. Just deal with it. It's on your screen. You can right click and resubmit the claim, right click, call the insurance company, whatever you have to do. But the tool that I use for working the insurance accounts receivable, as you put it, is just the claims button on the front screen, sorted by the age of the claim, and I'm on the phone calling the insurance company and getting those things solved. First thing I do when I walk into an office is I go to that claims button, look at how many claims they have over 45 days, and find out what the problem is. That's as easy as it can be. That's the best tool for the accounts receivable. Debbie, yes, I will. I believe me, I'm trying to figure out how I can get out there as quick as possible. And yeah, I think I'll try to set up a Zoom call at some point today. That way we can dial in. Same thing that Diana was saying earlier about, remember, PTC can always dial into your computer to try to help out with some of these things. But when it comes to practice management questions, like, somebody helping with rescheduling your patients, that's not something the PTC necessarily should be in your practice doing. They don't have a program in place for that. But the more we request things, the more people who need those kind of things. Believe me, they're constantly looking at ways to expand what they're doing. But happy to try to help you with that and figure out a way that we can do a Zoom call. Maybe if I can do something, maybe tomorrow. My afternoon is going to get crazy, and maybe if we could do a Zoom call tomorrow, that might be better. But I think that would be better to be able to see a actual Eaglesoft screen so you can see what I'm talking about. But any other questions that you guys have? One of the questions that came in through my instant messenger was, how do I get Eaglesoft on my phone or computer at home? So I'm going to see if I can find, and I'm going to put a link right in the chat. Eaglesoft, and anybody can do this. Hopefully you guys know that, everybody says, how do you find these answers so fast? It's because all I do is I do a search in the group. I do just like you would do a Google search. I find keywords. So I just typed in Eaglesoft Mobile. Eaglesoft Mobile is let's call it a add-on for Eaglesoft, and I'm putting add-on in quotes. So, but it's something that you could actually load so that you can run Eaglesoft on your phone. You could also run it on a tablet or whatever, because it's kind of a web interface. It's not available for all versions, but it's something that you should look at. And I'm going to put a link, Eaglesoft. And remember, I'm dyslexic, so it takes me a while to type something without goofing it up. But and I'm going to send it to this person through instant messenger. So there you go. And so any questions that you guys have, you're welcome to shoot it out there in the chat. And again, if you don't want to put it in the chat because you don't want somebody to see it, you can always message me. You can text me. You can don't call me because we're on this call. But if there's anything that you guys can think of that you need me to help with, let me know. Trying my best to answer. My typical day is about 100 to 150 communications a day, where it's phone calls, emails, private messages, instant messages, all kinds of things. This has been crazy because some of the some of the issues are even crazier than normal. Oh, cool. So Diana just posted. Cool. All right, perfect. So FAQ and videos for Eaglesoft Mobile. So that is exactly what I was talking about. And I think in that link that I posted in the Facebook group, it leads you also to that FAQ. So good. It's pretty cool. When that came out, I was still a technology advisor for Patterson. It was one of the coolest things. I actually built my own little demo for it. I built my own little HTML demo for it so I could show it to everybody. I was so excited for it. But it's a great way to work on your Eaglesoft outside the practice, and it's a fantastic tool. Something you should definitely look at. It's something, especially I think most of the people in the group have IT people that work with them. It's definitely something you want to get everybody, get your IT company helping you set up. But it's pretty simple once it's set up and run. And all those people who were saying, well, I have a Mac, I have a, how can I run it on an iPad? It's perfect for that. So get on that. Look for Eaglesoft Mobile. Do a search in the group. Do a search in the FAQ page of the Eaglesoft.net, and you will find the information there. And let's see. I'm sorry if I look like I'm distracted, but I'm trying to look at all of my different social medias at the same time. So any other questions that you guys have, anything that's happening specifically in your town that may be able to help other people, let me know. Yep, you can use Eaglesoft Mobile across any platform. Yep, that's like I said, the coolest thing for you crazy Apple people out there. Then go for it. You can use Eaglesoft on an iPad, and like I said, I did a really cool demo version of it that you guys can view on the in the field guide using the links above. But it's a pretty cool tool, and it's great for right now as we're going through this process. All right. And again, what we're talking about a lot in this chat is the ability to retool your business so that when you get back to full speed in the office, you are lean and mean. So if you start utilizing Eaglesoft Mobile and you get up to speed with it, it's a great idea to be able to have Eaglesoft Mobile on a tablet, on an iPad, to be able to walk in an operatory with a full version of Eaglesoft and be able to show a patient, to drag your chair next to them and actually show them Eaglesoft, show them their imaging right on an iPad. It's a pretty cool tool. So definitely look into that. And I'm trying to see, lots of people just came in. I see my buddy Diana, who is also a TA, who's one of my neighbors in Pennsylvania, and Dave Rice and Jane. Good to see you, Jane. Anybody have any other questions that came up since the last time we were online? Please let me know. I'm happy to help. And let's see. Oh, there you go, Ashley. Any helpful hints for tracking, rebooking that we may be missing? We are rebooking who we can using sooner if possible box and leaving anyone who is not rebooked in their original appointment to know exactly. Okay, you're doing exactly what I would do. I would leave my patients on the schedule as I move. I tell the story all the time in my seminars that one of the practices that I was a consultant for was in the World Trade Center. I've been through sort of disaster training before, and I don't want to equate this with the same thing, but when you have to rebook, like we did in the offices in New York City, when you have to rebook, one of the best things is not to move people out of your schedule, because you need to see where they were. You need to see what was going on. So leave them where they are until you move them. Get in touch with Revenue Well, get in touch with, if you use somebody other than Revenue Well, to help you so that, it's not confirming appointments for the next couple of weeks, whatever you're going to take. But leave your patients where they are until you rebook them. It'll make things so much easier. It's an easier tracking mechanism. And then when you do reschedule them, make sure you're putting notes in your system. This is a great time to set up administrative auto notes, so that as you move people, you're telling them. I mean, you're notating in the record why, how, what happened when you moved them, so that we're clear on that. North Carolina here. Okay, you are so amazing. Hey, you helped us. You helped me so much. Oh, thank you. I'm not amazing. I'm as amazing as Google. I just know where the information is. So just here to help, whatever I can do to help. But Sharon, thank you for the good words. And let's see. I'm trying to make sure that I'm not missing anybody. I'm getting bombarded with questions outside of the chat. So let's see. Somebody knows me. They sent me a text with just smiley faces. Thank you. I'll message you back when we're done here. But anything that you guys can think of, I said it earlier, and I'm going to keep saying this over and over again. If you have a post on your office's Facebook page that says something like "We are closed," please take that down and rewrite it and say that you are not seeing patients except for emergency patients. I think I put some wording in one of the posts earlier, but please stop saying you're closed. You're not closed. You're not available for routine treatment, but you're available for emergencies. I'm going to put a post up after I get done with it. I'm working on like a placard that says what an emergency is, because the worst thing that you can imagine is that your patients are in pain and all they're getting on a voicemail is that you're closed. You should say, we're available to you, so that when you're ready, and maybe when the governors have said that you're able to go back to care, that people don't think, oh, well, they're closed. So, let's make sure we're clear about that. Administrative auto notes. Okay, so I'm going to go over here. Somebody asked, where are my admin notes? Admin auto notes. And I think I will pull up if not, I'm going to find a link to that, but I'm pretty sure that my admin auto notes are in the file section of the Facebook group. So if you look over there, if they're not there, then yell at me, send me a message, and I will make sure that I put them out there. But admin auto notes are basically the same kind of auto notes that the back would use. But now you have notes that you post when you left a message for a patient, or you get a denial from an insurance company. Instead of having to retype that every single time, you have admin auto notes. So that says, and I think I posted it for somebody a little while ago for reaching a max. So I did just post that. So Nicole, I will definitely post something on there as soon as we get done. I can't find it as we're talking, but as soon as I find it, I'll put it there. On it, thank you. I'm not the best. I'm just one of the best. All right. We use what was recommended by Revenue Well. I don't know what you mean by that. Are you talking about if you're talking about closed, then okay. But like I said, I see people posting all the time that they're closed. I personally, I hate it. I am a customer service expert. This is where I get my income, from teaching people customer service skills. You can't tell today because I'm in a hoodie and I haven't shaved, but I am a customer service trainer. I've been trained by Disney. I've been trained by Ritz-Carlton, and it's just bad business to say that you're closed. Anyway, Debbie, we forwarded our phone lines to our cell phones that were not in the office. Calls are not missed. Amen. See, Debbie, she's my friend. She's the person I'd be hanging out with in California if I wasn't here in Pennsylvania. So yeah, you should always, when I worked in an office, our phone never went unanswered. So when do you have time to make your YouTube videos regarding Eaglesoft and your tricks? I don't know. My plan was to try to do that over the last Christmas break. For people who don't know, I don't travel. I don't do any seminars. I don't do any travel between Thanksgiving and March 1st. And my goal was to try to get some of that stuff done over this period of time. But So many things happened over the Christmas break. I didn't get a chance to do that. So my goal is to try to do more YouTube videos. My oldest son is a full-time YouTuber, and he's promised to help his old dad to get through some of this. My entire office is being redone as a video studio. If you can see right there, that's my high-end camera to be able to do videos. This is being redone. This office, I have two offices in my house. This office is being redone as a video studio, and I'm going to try to do some more videos. But you know, if time was on my side, we'd be getting done some very soon. Nicole, closing of office. Okay, yeah, so I guess that's what they did say. We are staying in office to answer calls and to triage office emergencies. Exactly. So Nicole, that's why I don't like saying that the office is closed. You are in, you were there. Somebody, one of my friends posted something that was really cool that they posted, while all the others are closed, we're here for you. That office will slam dunk when people get back to the norm. They are brilliant for saying, while everybody else is closed, we're here for you. Brilliant. I mean, and think about this. If you were an Aspen or a Heartland or something like that, and that was your thing, and all you're doing is emergency medicine right now, who's going to come out ahead? I hate to put it that way, guys, but that is the nature of the beast. So be aware. Debbie, we hope to keep team employed during this time, utilize time to train and share with us again. Yeah, I'm available all the time. At this point, I have a ticket booked to go to an office next week in South Carolina. I'm very, I live my life every day as if it's my last, so I don't really worry about this kind of stuff. But I realize I've got a 91-year-old mother who I spend a lot of time with, and I don't want to pass on anything to her. So I'm very concerned about traveling at this point, only not because of what I have, but what I might get. So, but hopefully we can get past this a little sooner. And luckily I've been in the dental field 30 years. I kind of know how to keep my hands and myself clean. I've got boxes and boxes of gloves. Yes, I have black latex gloves. Everybody knows I only wear black. I have black latex gloves. Only thing I didn't get was black masks. So I have like yellow and pink masks. So, but it is what it is. Nicole agreed. Good. Diana, to keep track of patients that need rebooking, you could also use recall notes and edit patient window. Yep, and that is exactly what I was suggesting. Use Money Finder to find those patients, to come up with specific words. Yeah, and again, this is why I wish we had. Some of the things that come up, like using Money Finder to be able to pull up people who have information in the recall notes field. That's the kind of stuff that in a Zoom call would be really easy to show. So we'll work on that tomorrow. Great idea, Diana. Love the idea. Thank you. You're very welcome. Remote or online webinars. Yeah, I'm going to try, like I said, I'm going to try to do some Zoom calls for the group. And then I've already promised some of the people who I had already had booked to go to their offices, instead of going to the offices, that I would do some remote sessions. That's probably something that, this is a new normal, and I guess it's something we're gonna have to work on. Hey, Vicki, good to see you. I'm gonna have to work on doing some remote sessions with offices, just because it's probably easier for me to do remote sessions than to try to fly and get there. It takes me 2 days of travel to do 1 day of in-office work in California. It's taken me 2 to 3 days to do some offices in like rural Kansas. So I'm going to try to do some more remote stuff to help out offices. It's tough because I think remote sessions like this, and I know I do. I tend to zone out as I'm doing remote stuff, but I'll try to do more. Whatever I can do to help. If you guys don't know, this is not just a thing that I do. This is a mission. This is something I promised my brother-in-law when he got me into this business that I would help other doctors do. So it's this is not just me hanging out with you guys. This is me on a mission. So happy to help whatever I can. Let's see. I'm trying to see if there's other questions that came in. I'm getting dinged on all kinds of things. Instant Messenger. Good. So any questions that you guys have, post them in the group, and then I'll try to figure out a time. Actually, nope, I can't open up my schedule. Believe it or not, my Outlook crashed today, so I can't even get my Outlook to open properly. Tomorrow, I'm going to try to book a Zoom session tomorrow around the same time where I can actually do some screen sharing so you guys can see Eaglesoft as we go, because it's so much easier to be able to show you some stuff. That's why I'm forever doing screenshots as people are asking questions in the group. And one of the things I want to find out too is what do you guys want? This is 2020. This will be coming up soon. Will be the 4-year anniversary of the group. So tell me what you guys want out of the group too. Andre, do you have sample messaging to help me send an email to patients to stress we're only doing emergencies? Yes, I'm actually working on that right now. I wish I could have, again, I wish I could show you my screen grab, but I found a really cool thing that a university put out, and I'm reading from it as I'm working on it, but it basically says, do not go to your dentist unless there is a dental emergency. And then it says, what is a dental emergency? And it says, heavy bleeding that does not stop, swelling infection that makes it hard to breathe, tooth that has become knocked out, severe tooth pain. And it's very clear that these are the things that patients should come in. I'm going to add, along with that tooth being knocked out, if they have a temporary crown that needs to be re-cemented, that is also what would be considered a dental emergency, and have the patients come in. Again, I'm going to keep saying this because different people are coming into the group at the same time. This is the time to start retooling your office and thinking about some of the things that we need to do going forward. Everybody's talking about aerosols and the spray of a Cavitron. I work with one of the people who works for me, a dentist in Sao Paulo, Brazil. She doesn't come into the operatory without a full plexi mask on. The way that they treat patients in other countries is a little different than how we do it here. But having these plexi masks, which, I mean, yeah, I know people wear goggles and stuff like that, but having those masks, just even if they're just available, should be something you do. The offices that I work with, I have a big office I work with that's a federally qualified healthcare center here in Philadelphia, and that's something that they routinely do. The way that I look at how they wear protective equipment is completely different than what I see as a norm, but it's something that needs to become the new norm. Those are the things that we should have available to us, so that now that we're in a situation where we are facing an emergency situation, those things should have been in our back pocket available to use. So those are the things that I think we need to start thinking about to have. But yeah, I will put some samples out there, sample messaging out there. RevenueWell has created they have a toolkit that they just posted. And for those who are not in the RevenueWell Rockstar group, I'm gonna grab a link here and post that here. So if you are a RevenueWell user, just recently they posted a toolkit so that you can, what is it called? The COVID-19 resources for dental practices. So if you are a RevenueWell user, hit that link, go out there, join the RevenueWell Rockstar page, and make sure you're fully utilizing the tools that we have available. And this is a great time for the doctors who were never involved in the practice management part of your office. This is a great time to get up to speed on how some of these tools work. The combination of what we talked about a little while ago, which was Eaglesoft Mobile, which is a sort of a web-based version of Eaglesoft that you connect back to your main database. I'm paraphrasing that just to try to make it as simple as possible. But imagine being able to put Eaglesoft on an iPad and run it from home, almost exactly the way that you can run it in the office. The only thing, and I'm behind on this because I haven't used I'm not a certified technology advisor anymore, but when I was a trainer, the only thing that you couldn't do was to move appointments from Eaglesoft Mobile. You could do pretty much everything else. Correct me if I'm wrong, any of those TAs who are out there who are still using it. So let me know what you guys, if there's any difference there, but you can pretty much do everything with Eaglesoft Mobile. And again, I'm putting this in with an asterisk, other than moving appointments. So it's a great tool to use. So get out there and use it, but learn how to fully utilize the software. I've seen too many posts where doctors are there by themselves and they don't really know how to utilize the software. So this is the time to learn. This is the time to dig deep. Nicole, it says we did use that. Are you talking about the toolbox from RevenueWell? I'm assuming that's what it was after I just posted that. So I'm going to assume that's what it was. Vic, good to see you in the group. Vicky, good to see you. And Christine, good to see you. How's things in Austin? So let me know what you guys are going through, if there's anything I can help with. And let's see. I'm not ignoring you. I'm checking. I'm getting messages through, believe it or not, Instagram, Facebook, getting some text, getting private messages. My son just heard me mention his name, and he sent me a message to try to send you guys a link to his YouTube channel, but I'm not going to do that today. He can get his own business. Let's see what else we got here. What's this? It came in. Okay, let's see. I can't tell if this came in. I can't see it. Okay. Started working for dental practice. Our current provider brought a practice from a provider that practice here. I don't know if you guys can see this. I don't know how come I can't see this in the chat, but it came through on Facebook. It says, our current provider brought the practice from a provider that has practice here for many years. Our office is not in network with any insurance, and their coverage books are old. We're waiting to update coverage books so the estimations are our recipe, and our receipts are correct. We're looking at your guide, but it's a little overwhelming. Yes, yeah, because there's been a lot written about coverage books. For someone new to the field, where is the best place to get more information of coverage books and insurance billing for newbies? Okay, so let's just talk about Eaglesoft Field Guide 101. And just so you guys know, there's 33 people in here, but hopefully you guys get the word out if for those who don't know this. Okay. So the way that the field guide was originally set up was there were literally the same, like there's 35 people who are on this chat now. There were 35 people who asked me if I would set up a page to help them with Eaglesoft. And I said, absolutely not. What I'll do is I'll set up a group where you guys can chat amongst yourselves. That 35 people turned into 100 people. That 100 people turned into 1,000 people. That 1,000 people turned into where we are now with almost 9,000 people. So the original post, so if you do a search for, like, say, coverage book, you're going to see an original post where I posted an entire, treatise on how to do a coverage book, how I would do a coverage book, and how I would do fee schedules. And those are my how-to sheets. I actually have a book that is how to do just about everything in Eaglesoft. And basically what I did is I just copied and pasted the chapters of those books into how to. And those things became threads. So people who agreed with me or disagreed with me would then comment after that thread. That being said, if you are new to the business and you just want my take on things, just read the first part of it. you don't have to get confused with the rest of it. Read how I do it, and go for it. If you don't like the way I do it, go and read somebody else's post. That's the way the field guide was originally set up. So there's lots of information in there. I try to call BS on the things that I completely disagree with. So there are good and bad in the group. And I can only tell you, if you think about this, I've been doing this for 30 years, working with Eaglesoft for, I guess it's 22 years. I've been in a practice, if you think about it, a practice a day for, let's just call it a practice a day for 15 years, 200 days a year. I've seen it, done it, been there, and I spend a whole lot of time cleaning up messes that were created by people who thought they knew what they were doing. So I try to put the best use scenarios when I post something in the group. If I don't know how to do it, I won't answer the question. I'm honest when it comes to reports. Don't ask me how to where to find something on a report. That's not my forte. I don't like reports. I don't print reports. It's to me, it's just paper. And there's a great saying that says, history is not a prediction of the future, it's a prediction of the past. So who cares what the report says? Tell me where you want to go and I'll tell you how to get there. So just my little soapbox for a moment there. Let's see. I'm trying to refresh this to see if there's anything else that popped up. But if you guys have any question, post them in the group, post them in the chat down here. And I'm here. There's a bunch of the technology advisors in the that are in the chat. So local technology advisors, local experts. There's some coding experts who I saw were in the chat. So if there's a question, post them away. Let me know what you guys are running into, and if there's anything I can help with. Let's see. I'd really love to know what's happening in some of the towns that who are like in the Bay Area, who are on mandatory shutdown. I don't know if that means that you can't go into the office. So it'd be interesting to find out from some people what's going on in areas. I was thrilled that with all of the misinformation and doublespeak that was happening, that Louisiana was the first state to say, absolutely, you can't do anything other than emergency care. And now everybody is trying to figure out what defines emergency care. But I was glad to see at least that they were clear on that, instead of saying it's recommended that you don't, because recommended to me is, you shouldn't have more than 3 glasses of tequila. And that's a good recommendation, but it doesn't mean that we're going to do it that way. So let's see. And FYI, be really careful. A good friend of mine, Geneva Pope, somebody hacked her Facebook page and was sending out videos. Be aware of some of the people who are doing crazy things, trying to get you to respond to things, because everybody knows that everybody's just kind of like posting stuff. Oh, hey, there's Philip. Cool. So I'm in the Bay Area and we have shut down. Perfect timing. As soon as I ask that question, he pops in. I'm glad you answered that. So does that mean that you can't even go into your office? That was kind of where I was going with that question. I went out this morning to Walmart to stock up on supplies, and that was about 6 o'clock this morning. Nobody was actually in. We have a rule in Pennsylvania or in my area at the moment that you can't go in the store between 6 and 7 unless you're over 60 years old. And sadly, I qualify, so I got to go between 6 and 7. It's kind of weird being a senior citizen, so I got to go at 6 o'clock this morning and go to the Bay Area. I'm in northern Minnesota, and it was recommended that we do not see regular patients. We are seeing emergencies if the need arrives. Yes, Lisa, that's exactly what I would hope everybody is doing. Philip, I'm in the office by myself. Okay, good, thank you. So yeah, and just so those people who didn't see, I'm gonna keep saying this because I hope everybody hears this. If you have a sign or if you have a Facebook post or whatever that says your office is closed, please take that thing down and reword it that says that you are not seeing patients for routine visits, but only treating emergencies. Please stop saying that your office is closed. It is the first sign of a business to go, completely in the dirt. If you say you're closed, uh, I may consider looking for another provider when time comes that offices reopen. I may seek emergency care at someplace else because you said you're closed. So please change the wording from closed to something else. Just be aware. Um, Debbie, OC prohibits public and private gatherings, so treating dental emergencies only. We are not bringing team all in together. Yeah, I guess you have to do it that way. Yep. Your screening calls, good. Yep, that's the way to do it. And the good thing about screening calls, and 100 years ago when I worked in a dental office, I carried around the original bag phones. We never used a phone service. We never used an answering machine. Our phones rolled over to that stupid bag phone, and I answered calls. And up until the day that I left working in a dental office, we never had anything other than me answering emergency calls other than the doctor. So, we had less than 5% cancellation rate because of that. So, you got to answer your phone. You got to take care of your customers. And remember, in your office, every person is a customer until they sit in the chair and they put the little stupid bib on. Then they become a patient. When they take the bib off, they are now customers again. And you have to think about it a lot like that. They're customers because, especially with insurance and people are fickle, if they see a shiny penny on the other side of the street, they'll go pick it up. So you have to make sure that you take care of your customer. Vicky, all right. Yeah, I'm there with you. It's strange to be in a 60+ group. Yeah. I was this Friday, I was supposed to be lecturing to about 300 doctors in Chicago. And that was obviously canceled. Last Friday, I was in Baltimore speaking to a group, but it was only about 15 people there. And that was strange because we set the room up as a U and spaced everybody, every other chair. But even there, it was a little ominous. So it's a little weird. So here in Michigan, we're doing the same, emergency appointments only. Perfect, Terry. Thank you for taking care of your customers and your patients. All right. Ohio recommends that we inventory PPE in case hospitals need it. Yeah, that's a big deal. And obviously, you guys, I'm sure you saw the handwriting on the wall with gloves and masks being dribbled out as they were. Before this became very big, I was in Home Depot because I was telling everybody earlier, I'm painting and redoing my studio here. And I was buying, masks so I don't have to breathe in latex paint. And somebody was there buying shopping carts full of masks to ship abroad. This was when the China outbreak originally started. It's a shame that people have hoarded some of these things, but it's getting a little crazy out there, and it's a shame for the folks that especially have good friends who are nurses, physicians who are on the front lines, and hopefully we're taking care of them. So. And let's see, somebody sent me another message. So bear with me, guys, because I'm trying to check all of my social media as we're going because I'm getting messages from 3 different places. And that's a typical practice management question. I'll answer that another time. We're here in OC. We can only see emergencies. However, the city we cannot visit with our home families. Doctors have to see patients on their own, no staff. Yeah, and it's crazy. I'm assuming you're the OC, so Ocean County. Okay, yeah. So yeah, it's I know who that is, Christina. Yeah. So it's a little crazy. we can only cast with yeah. Yeah, it's a little crazy, and I was saying that I travel a whole lot, and I don't have a fear of traveling at the moment, but I have a 91-year-old mother who I um, take care of. I share responsibilities to take care of, and I realize if I travel, I probably shouldn't be taking care of her. So I think first priority is taking care of mom. So I'm choosing not to travel, but it's a little crazy out there. But I know if I were still working in a dental practice, if I still had my practice, I would probably be in there today on the phone. And that's why a little while ago we were talking about Eaglesoft Mobile, talking about having remote systems to be able to dial into your practice. I carry 2 laptops with me every time I travel. One is a Chromebook, and one is a Surface Pro. Both of those computers have absolutely no data on them. And what I do is I get to someplace and I dial back into the computer that I'm working on now. And I have another computer here in the office that I dial into. And I do 99% of my work remotely on those onto those computers from remote computers. So everybody should start getting in the habit of having a way to remote into your practice. I wish she was in the chat, but some of our friends who are in the Houston area, who can give us some lessons on what happened during the flood, on how they had to remote into the office, and how important that is to be able to do that, because some of these places where they're telling you can't even, it's not martial law yet, but to be held up in your own house and you can't get into the office to do the work. Well, what if you do need to push the schedule out another week or whatever you have to do? Having a remote access to the computer is a big deal. So a couple things to look at some of the remote in services, make sure that they are HIPAA compliant and they follow your IT standards. And then the other part is look at Eaglesoft Mobile, which of course would already be HIPAA compliant and should fit in with a great protocol. So look into these things. And again, one of the things that I'm going to keep harping on is how do we keep our practices lean, mean, and ready for when we go back to treating patients? What are you doing? What are you saying? A really good friend of mine, Lori, posted that what they were doing in this meantime was sanitizing the office. I'm paraphrasing, but sanitizing the office, making sure everything was clean, making sure all surfaces have been clean and disinfected, so that when they reopen, they are ready to see their patients again. That's a really important thing that everybody should be doing right now, is getting out there and making sure you're saying the right things. I'm sure everybody is being bombarded with notices from Chipotle and every other food organization out there, and take some of the lines from the messages they're using and post and use those in some of the notices you give to your patients. Keep in touch with your patients. Alex Nudell asked how often you should be communicating with your patients, and go in that group and the Revenue Well group and look at some of the answers. I think it's important that you stay in touch with people, not just bombarding them with marketing information, but letting them know what's happening in the practice. Let them know what you're doing in the meantime to make sure that everything's okay. Making sure that they understand the process of what's going to happen when you guys get back and you're ready to see patients. Whatever you can think of. One of the things that I talk about all the time in my seminars, that when we get back up and running, you guys should be ready for the fact that you're going to have restorative, but that restorative will still just be booked out 3, 4, 5 weeks, whatever you typically are booked out. Your restorative schedule is going to be booked out that far. But remember, you now have to have hygiene at a level where you're going to see 2, 3, 4 times the number of patients. So if anybody's been to my seminar, they know how I do hygiene days where I bring in temp hygienist, and I will actually have, if I have 4 chairs in my office, all 4 chairs are going to be going at hygiene on that hygiene day. And the doctor only does exams and consults those days. So if you can work your schedule out that way, you're going to utilize your existing patient base to get them all back in and all back on schedule. So imagine day one. I mean, I think it's going to be crazy, but imagine, day 10 of coming back into your practice. If you have a full day where you have all of your chairs running hygiene, you're going to do a couple things. For one, you're not going to have a backlog of patients. Patients will be able to come back in. They'll get back on your schedule. September will be back to normal because then you'll be able to schedule people on a normal 6-month recall. But the big thing is, and this is for my hygiene friends out there. Maybe there's some hygienists who aren't going to be going back to work the same way they were before, and now we can offer them some part-time work to be able to see patients. So instead of having 2 chairs of hygiene and 1 chair of doctor take the day off from restorative care and have 4 hygiene chairs with 2 part-time hygienists. And now we can see 4 times the patients. We can get our system back up and running and really cooking through our patients. So what my goal is that I want to be able to help you guys think about not what's going on right now, but think about what's going on when you reopen. Think about that your fee schedules, coverage books, outstanding claims. I wouldn't work on patient accounts receivable right now, because I'm telling you right now, if you're sending a bill to a patient during this process, you are going to piss off some people. I mean, because everybody else in the industry, every bank, everybody else is trying to figure out how to not bombard people with bills. So I know we all need the money, but I think be very careful if you're going to be using this time to try to lower your accounts receivable. It is a dangerous thing to do right now. I'd be very careful about that. So many people are trying to figure out how they can pay their grocery bills. And yeah, we need the money in dentistry, but just be really careful if you're going to send out statements during this period of time. It's just a really sticky time to do that. So, and as always, my opinion, but you're in my Facebook group, so hopefully you understand that the things that I say in the group are my opinion. Let's see. Golly. I am getting bombarded with get rich quick things. I'm on a lot of Facebook groups where some people think that I'm a hygienist, and I'm getting bombarded with things where people are saying, do this and you'll make money if you don't have a job. Oh God, I can't stand people like that. It's like vultures circling above. And okay, Courtney, I got your message. I'll try to, as soon as we get done with the chat, I'll try to answer that in a very clear way so I can help you out on that one. Anybody else have any other questions, anything that's going on for you guys, docs who are there by themselves? How's things going for you? How many people are in still treating patients? I keep seeing a few offices where doctors will not shut down. They're using their quote unquote best judgment to still see patients on an ongoing basis. I don't know. Let's see. And there's a couple of great links that have been posted. If you guys scroll back through the comments that were posted, there's some really good links that were posted. A couple things like sending out emails to all patients, some things like how to set up Eaglesoft Mobile, which if you're an Eaglesoft user, there is no cost for Eaglesoft Mobile. It is just like an add-on that you install, and now you can use Eaglesoft on an iPad or on your phone if you want to. It's a little tough to be able to use it on your phone, but it is possible. Kellyanne, you guys are closing today. Yeah. And the question I asked yesterday about people who are closing, are you closing because it's mandated, because you chose to close, because whatever, that's been my big question through this. If you're closing, why are you closing? And hopefully it's because you think it's the best thing to do, but you know what I mean. So let me know. And I know Kellyanne's in Tennessee. So I always want to find out from each state kind of what everybody's up to, what everybody's doing. And let's see. What time is it? 1:35. So questions that you guys have, because I see some people, I see people on the West Coast. I see my friends in the OC. I'm glad that Philip let me know what was happening in the Bay Area. That was perfect timing. Had the question about the Bay Area, and he chimed right in with the answer. Chose to close. Yep, biggest thing to do. A little fear and liability issues. Yeah, and you know what? Here's the things. And again, this goes to misinformation on Facebook. Not that Facebook would ever have misinformation, but there's some information about, I believe me, I'm sad today too. Misinformation about liability. Somebody said there's absolutely no way that you could be liable if somebody got it from the spray in the office because they took a chance to walk outside where they could be infected by anybody. I think when people say things like that, be really leery of things like that. So we'll see. Angie and Alex in Houston, and same lot of us are open. It's weird, and it's Texans for you, but yeah, a lot of Texas offices are still open, and maybe it's because of the advice that comes down from the TDA and from ADA. ADA said we recommend that offices are closed. Well, that's nice that you recommend it. Tough. So and I hate to use this parallel, but I mean, I lived through the AIDS epidemic, and in offices that, at that time, there were still doctors who weren't wearing gloves. And it was recommended that doctors wear gloves, and, they chose to do what they wanted to do. So it's amazing, but it is what it is. Teresa, we are postponing patients under the advice of the New York State Dental Association, ADA. Good for you. I agree. That's what we should be doing. Valerie, we split staff into two groups, one to keep open and one to alternate. That's awesome. So Valerie posted that they're split the staff, so they have, they're pretty much working 1 week on, 1 week off, 1 week on, 1 week off. That is amazing. If doctors can afford to do that, that's fantastic. This goes back to, some of the things that, as I built my business, being able to support people in times of trouble, these are the kind of things that we have to all think about right now as we go forward. Some of the people in the group who went through the floods in Houston, Angie and Alex, I don't know if you guys were affected, but when these are lessons that we should learn as we go forward. So, hey, Wyatt, good afternoon to you too. Good to see you in the group. Yep, Valerie, you guys are saying so. Emergency patients only. Yeah, I kind of assume that, but yeah, this is the time where, and I wish we would have a clear definition of what an emergency is, and that would be something that would have been really helpful to come down from the ADA along with their quote unquote recommendation, what an emergency is. And Bev just joined the group, so Bev, good to see you too. Bev's only right up the road from me, but we're sheltering in place, so I can't see Bev. So, but anything that you guys have, I don't know if you saw, I did a post on my personal page. So those people who are my personal friends, I did a post, and I think I did put in the Facebook group too. Intermediate Dental shut down completely yesterday. The entire company closed. Now I'll give the asterisks there to let you know that they were already in financial trouble. 25 locations across the country, and they had shut down a bunch of the locations, and now they are out of business as of Tuesday. All doctors and staff are let go. So they use this as a reason I won't say an excuse, but this was a reason they weren't doing well, and they used this as a reason to close. They were in Kentucky, Ohio, and one other state. I can't think of it off the top of my head, but they shut down their entire business. So I applaud Valerie, your office, to be able to work with your staff so that people can work in and out of the office and still treat your emergency patients. Terry, hi, how are you too? Good to see you. Thank you for being part of this. And like I said, any questions you guys have, I'm here. There are some folks on the line from the PTC, so questions that you have that come up, post them. I'm watching them. I'm going to answer them. I'm going to try to do some other posts. I'm going to try to do a Zoom call tomorrow based on my schedule. I'm going to try to see what I can do in order to do a Zoom call. So if you have questions, I can actually do it can show you on Eaglesoft as we go. So if you have questions, I can actually show you in Eaglesoft where to do it. But this is again the time to take to actually go into Eaglesoft, clean up some stuff, get ready so that when you're up and running, you can like just hit it out of the park. You're ready to go. Andre, we have closed and we're only seeing urgent need patients. We received a recommendation from Alabama Association to classify urgent need. Yeah, I did see Alabama. Alabama did a good job. I've actually cut and pasted that. Alabama did a great job of showing what they consider emergency or urgent need. Thank goodness. And like I said, Louisiana was very clear on, shut down, not recommended, shut down and only see emergency care. And Alabama was very clear on what urgent care was. I wish that recommendation that information had come down from ADA. That would have been a whole lot easier than dancing around like they've done. So glad that Alabama did that. Alabama is my home away from home. It's where I spent most of my youth. My parents are from Montgomery, Alabama, and sweet home Alabama. So I spent a lot of my time in Alabama. And hopefully once this thing is over, we do have scheduled a day to be back in Birmingham doing an Eaglesoft live event with the Birmingham branch. So I will be, God willing, in Birmingham in the fall. And hopefully I'll get a chance to see all my Alabama family, Eaglesoft family, and family down there when I get down there. Let's see, somebody is sending me a email. All right, so all my Nevada friends. So I spend a whole lot of time in, I spend about once a quarter in Las Vegas. It's my place to go to hide. So I go to Vegas a lot. So the governor of Nevada just closed all casinos. So FYI, just so you know. Let's see. I would love to attend that in the fall. So yep, just so you know that I think there was an Eaglesoft field guide scheduled about once a month in states all around the country. Michigan, Connecticut, where else? All over the place. So there's going to be a bunch that were postponed. Maine was the first to get postponed because it was the closest to today. I think it was 2 weeks from now. These things are getting postponed and then rescheduled, and hopefully we'll get a chance to see everybody. As much as I love seeing you guys online, I love seeing you in person too. So hopefully you'll get a chance to see me there. At the President's News Conference today was the first I've heard that dental services are being mentioned specifically and only emergency patients. Yep. Yesterday that was mentioned about dental services being postponed. But again, it's coming out as a recommendation and not a hard, no, don't do it. So again, I wish it would have been a hard, don't do this. Somebody sent me what I sent them. Somebody said, go ahead and post. I sent one of my doctors a message yesterday because they posted a notice on their Facebook page that they were closed, and I'm going to keep saying it. Stop saying you're closed. What I sent them is some, I hate the word verbiage. I sent them some language to post, pick and choose some things to say. So I'm going to post it. Whoops, cancel that. I'm going to post it here. Some of the things that I said should be used. Don't just cut and paste that. take some of the words out of that to use in some of the language that you want to use. A little while ago, I forget who it was asking me some of the language that I used. So that's some of the things that I sent to offices that I work with one-on-one as sort of language to be able to use as you post things for your patients. Terry says, I pulled my master list with inactive patients with insurance so we could clean up our insurances. How do I remove insurances from inactive patients if they are the policyholders? Terry, what you're going to have to do is you're going to have to open up each policyholder, click on the patients they're connected to, take the insurance off of those patients, and then finally remove the insurance from the policyholder. It's a slow and painful process, but it's the only way. But again, now is the time. Draw a line in the sand and say, from this point forward, if we inactivate a patient, we remove their insurance. So this is one of those soapboxes I stand on every day in the Facebook group. It's kind of the sins of the father are on the shoulders of the children, whatever that phrase is. Whoever inactivated those patients with insurance on them, they just left you with the problem to clean up now. So you're gonna have to go and literally go in and activate the patients, take their insurance off, inactivate the patients, go through that whole process. It is literally a process to get cleaned up. Let's see. I'm checking social media to see if there are other things that have popped up. Bear with me, guys. Okay, so somebody says, is this a good option to use? Oh, somebody posted in the Facebook group about Eaglesoft Mobile. Is this a good option to use during this crisis? Oh, heck yeah. So yeah, I posted a link. If you scroll up through the chat, you'll see the link, and maybe I'll just put another link here while we're talking. Eaglesoft Mobile, if you didn't know that it existed, here it is. Check it out. It is a way that you can connect to your office on an iPad, on a phone, on any kind of machine that has a web interface. You can connect to your office and run Eaglesoft on that device. And as of 3 years ago, I mean, that's how long I have not been an Eaglesoft trainer. As of 3 years ago, you couldn't change appointments from Eaglesoft Mobile. I don't know that that has changed or not. So you'll have to tell me, but you can do everything else other than changing a patient's appointment. You can't move things on the schedule. You can view your schedule, but you can't move them. So, but it's a great tool, so go check it out. Okay. Is there a way to log into Eaglesoft from home? Oh, okay. So Heather, you were the person that asked the question in the Facebook group, and good, you got it. But non-employees, yeah. So for Heather, who asked the question about logging into the computer from home, so yes, you can use Eaglesoft Mobile, or you can have your IT folks help you with setting up Chrome Remote Desktop. I don't know how HIPAA compliant it is. It's what I use, but not to get into patient data. So I use Remote Desktop. And again, maybe some IT folks who are in the group can help us with, is Chrome Remote Desktop HIPAA compliant? But there's things like Log Me In, there's TeamViewer, there's a whole lot of different options. There have been a couple of discussions. If you go through the recent threads, you'll see some discussions on remote access to your computer, what things are recommended, what things are not. I personally use Chrome Remote Desktop to connect back to my computer. And so it's something to think about. And somebody is calling me, which I'm going to go to voicemail. So if there's anything, but yes, Terry, great idea. Like I said, I use Chrome Remote Desktop, so I am a huge fan of it, but I don't know if it is HIPAA compliant to be able to dial into your patient information. So just double check on that with your IT company, whatever, do a Google search, whatever, to see if you can find out if Chrome Remote Desktop is HIPAA compliant. Let's see. Oh, that's not interesting. And anything else that you guys can think of? I'm going to try to hold out for the full time because I know that there are a lot of people logging in from West Coast, and I see some folks from um, Tennessee, Florida, Pennsylvania. So I just want to make sure that I'm on here long enough that I can cover all the questions that come up. And, that's what I'm here for, whatever I can do to help. Like I said, I'm not the only one that's here to help. There's a bunch of technology advisors in the group. There are some folks in here from the PTC. So there are people here, not just me, not just PTC, not just technology advisors, but also other users who are here to help. So ask your questions, see what we can do to help. We're here to help, but be very careful of, I've seen 3 posts so far that I've had to take down where people have asked questions and the responses have been, oh, call me and I'll be happy to help you. That's not something we recommend that is allowed in the group. If somebody's soliciting you for some service, let me know. I'm going to slam it and get them out of the group. But this isn't the time for somebody to make money off of your hardship. This is the time for us to help each other and get through this. So just be aware. Has anyone created a list of things that we'll be working on? Not seeing patients? Yes. So I had the question a couple times. What things should you be working on? My primary thing to work on, and I always think about this: what is the small? When you eat an elephant, how do you do it? One bite at a time. So the easiest way to bite is to work on insurance companies. We have less insurance companies than we do have employers. We have less employers than we have patients. So let's work on our insurance companies. Let's clean up that list. I mean, there's only 3 Pennsylvania. Delta Dental of Pennsylvania. There's PO Box 2059. There is Box 2105. It's terrible. I know those addresses, but I don't know my kids' birthdays. 2059, 2105. All right. And then there's 2059 for AARP. So in your system, if you have Delta Dental of Pennsylvania 500 times, that should be a list of 3. Okay. So if you can get down to that, then you can start to clean up those lists. Now we can start to clean up employers. And if we can clean up the employers, if you sort by group number, and this is why I wish I could do this as a Zoom call so I can show you on Eaglesoft. If we sort by group number, you're going to go through group numbers and you're going to see, initially, if you go down the list, you're going to see group number 104, group number 105. And then as the employer names, you're going to see things like retired. You're going to see mail handlers. You're going to see government employers. You're going to see something like that where they're all federal employees. All right. So if you could just make it generic and say federal employee, group number 104, group 105, they're all federal employees. You don't have to have mail handlers as opposed to something else. So we can clean up those lists and get rid of some of those things. And now we can go to the patients and connect the patients to the good employers that are now connected to the good insurance companies, which if we do it properly, have the correct claim payer IDs, which means it gets to the insurance company quicker, which means we don't have to worry about accounts receivable for claims. All right. So long story, but if we can do that, then that's the way to do it. It is really about cleaning up the system. But yeah, I have a list, and if I'll link something as soon as we get to the end of this with how to clean up in insurance companies, employers, and then patients. If there are long strings of information, but the top of it, where I basically wrote an article, like a how-to article. If you read the top part of it, you'll know how to do it. If you want some opinions on how to do it, then read what's under it. All right. Where can I send a mass email to my patients through Eaglesoft? Okay, so I'm going to pull that back up because that was Diana from the PTC posted how to do that a little while ago. And instead of trying to reinvent the wheel, if you want to, you can go through, I can't find it while I'm trying to do this, but it's in the Facebook, in the thread. If you scroll up, there's actually an FAQ on how to do that. If not, I'll make sure I repost it. I can't find it at the moment, but the Diana from the PTC posted a how-to. Oh, there it goes, and there it is. So thank you, thank you, thank you. And you guys give some love to Diana from PTC. She's right there. So make sure you guys are loving her up, because these are the folks who I've been working with forever and they're the best. So let's see. That's how you can do a mass email. You got it. Let's see. Good. I'm putting my heart on there too. Everybody post a heart over there for Diana, and she'll pass it to the rest of the folks at the PTC. But she has to do it with a fist bump. All right. Let's see. And I'm going to go in here and I'm going to do a search. And just so you guys know, I'm not some wizard at this. All I do is just like Google. If I need an answer, I go to the Facebook group, I do a search, and I find the articles I want, and I send those out to people. So copy link, clean up patients. Boom, there's your link. Employers. And what I used to tell people to do is, if you go do a search and you see a picture of me in the little preview picture, you kind of know that it's one that I originally wrote when I started the group, Cleaning Up Employers. Boom. And then Clean Up Insurance Companies. I'm going to find all three of these, post the link so you guys have it. Copy. Boom, done. Okay, so I put 3 links there so you guys have it. Deb, is this being recorded, or is there a way I can access this information again? It is. All the Facebook Lives are recorded. It's stored in the Facebook group. It's going to get buried down in the thread, but hopefully people will keep liking it, and it'll stay kind of active. But yeah, they're all still there. So if you need it, you got it. Let's see. Again, I'm checking all my social media. Can't believe that people send me messages through Instagram about Eaglesoft, but I guess they do. And everybody, just so you know, Boston Market is doing free delivery. Oh boy. And telemarketer. So any other questions that you guys have? Hopefully you saw some of the language that I put above about what you need to put on your Facebook page about your being available to emergency patients, but not necessarily being quote unquote closed. Please stop saying you're closed. Let people know what you're doing to keep, to clean up your office. Let people know what's going on in your practice, so that when we come out of our shells and we're looking to reestablish relationships with our practices, your message doesn't say you're closed and they decide to go someplace else. Again, if I'm in pain and the first words out of on your answering machine is "we are closed," I might hang up and call Bob's Emergency Dental Care to go get my crown re-cemented. And I say that because I did that. I had a crown that came out, and I was at a dental conference, and I started making phone calls to find out who could re-cement it. And every time I got a voicemail, I hung up and I called the next person in the list. So just be aware, if you're available to your patients, they are going to seek treatment. Let's see. And everybody is getting hacked. So FYI, people, lots of people getting hacked, lots of misinformation out there, lots of vultures trying to sell you stuff. Just be very aware. If you see something, don't click it, Google it and find out what it's all about. Let's see. And then Sarah posts a link. Let's see what that link is. Surface disinfectant. Okay, good. Yeah, good one. Thank you. Yeah, cavicide does not kill coronavirus or certain cavicides. So just be aware there are other options out there. Good, good, good. Thank you for the information. Yeah, perfect. All right. Yeah, everybody needs to know what's out there. I have people who are going in office to do cleanup, but they're not cleaning with the proper stuff. And also just be aware from my years at Patterson, make sure you're not spraying something on your brand new ADEC chairs that's going to destroy the fabric. So just be aware that cleaning is a process. It's not just do it. I know somebody who years ago used some sort of something to clean off a brand new granite countertop and ruined it. So you've got to clean, but you got to clean with the proper stuff that properly kills what you're trying to kill. So just be aware. Thank you, Sarah, for that information. Sarah is a awesome technology advisor in the Maine branch. So all you Mainers out there, hopefully we'll get a chance to get our Eaglesoft Field Guide Maine event back on the schedule once things blow over. So hopefully we'll get that done. I should have brought some water up here to my office. I don't have anything up here to drink other than clear nail polish, but I don't think that's a good idea. So let's see. I'm going to go switch back over here and see on Instant Messenger what else is going on here. Sorry, guys. I'm reading through a couple of these things. Somebody was asking what happened with little Andre, where he is. I don't know. There's 4 of them floating around the country. Well, no, there's 3 of them floating around the country. One of them broke his glasses, like all nerds. So there's one that has broken glasses. He was in Sacramento with Vicky, and then he traveled to another office. His glasses were broken in transit way before Sacramento. And so I took him out of the loop. He's headed back home to me, and I sent out a little A to the next office in line. But I don't know where those guys are. They're out partying someplace, or they're what do you call it? They're quarantining themselves, and they're not going out. So they're out someplace. Hopefully they'll get back on schedule and out to see everybody. But that's one of the most fun things we've been able to do in this Facebook group. And at least they got to go out. I didn't get to go out and see everybody, but they got to go out and see everybody. Let's see. Another question. Somebody asked me a question. Can you use Eaglesoft Mobile on a Android tablet? They specifically say a Galaxy Tab. Yes, hold on. So I actually have this Galaxy Tab A, and yes, it works fine on this. This is actually pretty cool because this is the 10.5-inch Galaxy Tab. I'm a big Samsung guy. The Galaxy Tab A, you can run Eaglesoft Mobile on this, and it is large enough that you can see it. I hate Apple products, so I don't have. I shouldn't say I don't have. I have 3 iPads over there on the shelf, but I would use it on that. So yeah, you can use Eaglesoft Mobile on that. So, all right, I think I've got to get something to drink, otherwise I'm gonna pass out. So I'm gonna put you guys on hold. Talk amongst yourself for a second. I'll be right back. Okay, I'm back. Sorry about that, guys. So I got my water. So any questions that you guys have, make sure you jump in and ask them, because we've got about 25 minutes. And Puya, my friend Puya Hatam just joined the group. So glad to see you. So any questions that you guys have, now that I'm back here, I can actually breathe again. Boy, that was bad. There are not just me here. There are technology advisors in the group. There are representatives from the PTC in the group. So we're here to help. So if you've got questions, throw them in there, put them down here in the comment screen and ask away. And let me know what I can do to help. For the next 20 minutes, we're working out whatever we can work out. There's some great links above for those who just came in, for people who, if you have some projects you want to work on while we are not seeing patients, there are some links to how to clean up patients, how to clean up employers, how to clean up insurance companies. And also, one of the big things we've been talking about today is now is the time to learn how to use Eaglesoft Mobile. Eaglesoft Mobile is it's a free add-on that you can just work with your IT company to install, so that you can run Eaglesoft on a tablet, iPad, Surface, anything that you can open up a web browser on, you can use it. You can even use it on your phone. So in theory, if you were out at dinner and your phone rang, and you were talking to a patient about treatment, you could theoretically look at your phone and look at the x-ray, because you can pinch and zoom. So you can zoom right in on an x-ray and go, yeah, I can see where that fracture was on number 18. And yeah, it'd be great to get you in next Tuesday to do that. So you can do pretty much everything that you can do from the desktop on the Eaglesoft mobile app. So definitely something to install, definitely something to look at, something to utilize. It's a great tool. Get on it. Let's see if there is anybody else in here. Oh, Ben, I see Ben just joined the chat. I was talking about Texas a little while ago. Let me know what you guys are doing in Texas. It seems like one of the last holdout states where nobody was closing. So I wonder what everybody's doing. People are texting me questions. I'll get to that later, because that's not a general question. That's kind of specific. So I'll come back to that. So anything that you guys want to cover, let me know. I'm going to hang out for another 20 minutes. It's 9 minutes after. I'll hang out for another little while, answer more questions. Let's go here. Let's see. I think I'm trying not to bore you guys with questions that were not specific to what we're talking about today. So I don't really see anything going on over here that I should cover. It's kind of eerie, the number of new people who have joined the group today and yesterday. It's funny because it's almost like they should have been in the group a long time ago, but thank goodness they found us. So, and I think there's a lot of information out there that I think this is a great place to be able to, really come in and look for some ways to utilize this time to make the practice better. So any questions that you guys have, make sure you're typing it down here in the comments. Look through the comments, and there are some really, really good links for some things to do while you're on downtime, how to clean up some stuff, how to better utilize the software. I posted something earlier about if you are a doctor who is now working on some of the management tools, and you hadn't done this before, even if you look at some of the links on cleanup, will also teach you some of the things that you need to do about setting up coverage books, setting up fee schedules. This is the time to dig in and learn how to better utilize those things. This is a great opportunity for doctors to look at the odontograph to find out, are there things that you are looking at that you might not have seen before? This is the time to dig deep and to see what you can find out to better utilize the software. Don't miss this opportunity to really get more out of what you're doing. This is a downtime, but it can be the best use of your time. I use as an example all the time that Starbucks shut down for a day. They lost $135 million, but they regained the faith of people like me who really believe in good coffee. Utilize this time to retool your practice. Figure out how to better estimate insurance so you're not waiting for insurance to come in that you should have collected at the time of service. Utilize this time to clean up your patients, your employers. I had a doctor who reached out to me Tuesday, I guess that was yesterday, who said that they were in the middle of selling the practice and that the active patient numbers were so far off that the first person who came in to evaluate the practice basically laughed because their numbers were so muddy. So, this is an opportunity for them to clean up their database, to show how many active patients they have, to show how many active patients they have with each insurance company, to show how much they've written off to different insurance companies, so that when they look at their PPO mix, they can see how many people with Delta, with Blue Shield, with Aetna, et cetera, et cetera. So it's a great opportunity to clean, not just from a CAVA point of view, but from a data point of view, to clean up, so that, again, lean, mean, you know where you are, you know what your capacities are, and you're ready to rock and roll when we're back on the hamster wheel. So utilize this time to do that. And luckily, I'm looking through the list of people who are in the group. I see a lot of dental spouses. I see a lot of folks who I know who are in the practice management world. So, utilize this time to be able to reach out to some of the experts, reach out to your local technology advisors. Sarah, who just posted from Maine, let's see who else might have been in there, but reach out to the PTC. There are some awesome videos, webinars that are recorded that you can look at. And I'm going to see if I can find this and put a link here for you. If you, this is the time where, if you've got somebody who's helping you out in the office who is a spouse, or you've got a teenager who's home from college and you're looking for something to do and they're helping you out in the practice, this is an opportunity where you can, teach them how to utilize the software. Let's see. This is how the person that took over the position I had in the practice, my niece, she used to come in the summer, and I would show her how to use Eaglesoft and show her how to really dig into the understanding how to utilize practice management software. Now she's she works for a big hospital system, and she's like, it's what I learned with using Eaglesoft that helped me with that. Sorry that she got out of the dental field, but here is a link to, if you're new to the practice, what you should learn. So there's a link there for people who are new to the software, but there's also within that a link to the PTC's page with their webinars that are some recorded webinars that you can watch, and lots of FAQ pages, frequently asked question pages. So it's a great tool to go in to look for some information. So I got about 15 minutes. I got 15 minutes, and then I've got to take another call. So let me know what you guys are thinking about. What do you guys need? What can I help with on my end? The future of what I'm doing with this group is going to be really different because it's going to be about more virtual stuff. Here's a question that came in from Ginger. Hey, Ginger. We have a mess to clean up after a crappy data conversion from SoftDent to Eaglesoft about 5 months ago. So I'm thankful for the time to get things done. Yeah. And I'm happy that this page is a resource. Yeah. And I'm glad Ginger put this out here. A conversion, you're always going to get garbage. And especially when you come from a software like SoftDent. SoftDent, the way that it handled data was so weird that it's a hard conversion. But yes, utilize this time, but make sure you're utilizing the time and doing it in a very systematic way. Because again, if you don't clean it properly, just like Sarah was just talking about, you can't use Cavicide for coronavirus. If you're cleaning the wrong way, the virus is still there. Sorry to use that analogy, but be very aware of some of the things that I talk about in the cleanup process. If I go in and I change Conseco Construction, and it says Conseco Construction, and I go through the process of updating benefits, and I go through all this process, in 6 months, I won't know that Conseco Construction was just updated 6 months ago. So as I update my employers, I would write Conseco Construction, I would write March 2020, so that I know that in March of 2020, Conseco Construction was just updated. That way, 6 months from now, when I'm in, whatever, 6 months from now, I'm in September, and I'm looking back, and a patient comes in and they have that same plan, I know that information is up to date, meaning it is close enough to that information was gathered in 2020. So I know that I don't have to go back and fix that again until March of 2021 or January of 2021. So make sure that as you clean up these things, you're not leaving a residual effect so that you're getting messed up for the next round. Because as I see all the time, I go in offices and somebody taught them how to inactivate patients, and all they're doing is putting ZZZ in front of their name. Well, the problem with that is when you go to type, when you have that patient call back and try to reschedule, and you don't realize that they're in your system because there's Z's in front of their name, you're just going to create the patient again, because you've changed the spelling, so it's messing you up. So be aware that some of the advice out there on how to clean up is just causing another problem in the future. So be aware that you can't clean up things in a bad way. So I'm glad you took my advice. It's working great. Perfect. Thanks, Ginger. And let us know if you need anything. I mean, believe me, I feel your pain. 10 years of being an Eaglesoft trainer. I've done hundreds of conversions, and all the ones from SoftDent, I always kind of just, felt like I needed a pillow to just sleep in the office as I was doing it, because it was just mind numbing. So I'm here with you. So you're putting that on the employer description. No, not the employer description. So Catherine asked, so I put that in the employer description. So now when I write the name, it's actually the employer name. So the employer name would be Conseco Construction. And and again, if you go up in the chat, you'll see my link to cleaning up employers. It would say Conseco Construction. I would have 320, and then I would put some other ID information in there. So it would say PID for those plans that require a patient identification number as opposed to a social security number. So it would say 320 PID, and then it would say NE if there was no eligibility available through real-time eligibility. So I put all kinds of things in the name of the employer so that I know all there is to know about that employer without having to go click on it, edit it, read the information, see all that kind of stuff. As a perfect example, in the adjoining state to mine, New Jersey, all state of New Jersey employees have the same state of New Jersey as the name of the employer, and they all have the same exact group number, just example 1, 2, 3, 4, 5. But the governor of New Jersey has a $10,000 max zero deductible plan. So his would be state of New Jersey, $10K, $0. All right. So I know immediately when I look at the list of state of New Jersey and I see $10K, zero deductible or $0, I know that's the governor's plan as opposed to the one that says $1,550. That's a $1,500 $50 deductible plan. So right in the name of it, I don't have to do much other than to look at the plan, and I know exactly what those plans are, even though they have the same group number. I don't need to click through and read them. Easy enough. And if I know that, Becky, who worked in the office, was a really bad person at putting information in, and she left in June of 2019. If I see a date that was May of 19, I know I've got to go back and completely redo that employer because I don't trust the information that she put into my system. So those indicators let me know a lot about a plan without having to click through, read. So hopefully that helps you, Catherine. Let's see. Heather, I love the idea of compiling a list of things the staff members to do to continue to work through the crisis, office cleanup and recall. Yep. And activating patients, all those things. Yep. Talking about, could we make the comprehensive list and add to? Yes. So I will create a post of what to do. I started doing it in that red barred coronavirus post of what to do. But yeah, I'll try to make a post of what to do during your downtime. What it will be, it'll be a link back to some of the other threads because I don't want to reinvent the wheel. Just really go back and just reread through those things. But yeah, good idea, Heather. I think that's a great idea to be able to redo some of the things that are already out there. We got about 8 minutes, and then I've got to get on a call, believe it or not, to a practice outside the U.S. who they're having the same issues we are. So I've got to talk to an office that is in a completely different time zone. So, and I've got to do that at 2:30. So I'm going to jump off at 2:30. But if there's other things that you guys can think of, shoot them out there as a question so I can help you. And remember, as we go through this process, there are people who are here to help. I see every single post. I will tag some folks at the PTC on posts that I think the PTC should be aware of. They are active members of the group. The people from the PTC are active members of the group, and they are watching what goes on so that they can help you guys. There are local technology advisors who are in the group sporadically throughout the U.S., most of which who are really good personal friends of mine. They are in the group. They are reading your messages and finding out what they can do to help. I can't tell you how many calls I get on a regular basis who say, I see that so-and-so is having a problem with this. I know that office. I could probably help them. And now they know that they should come out. You might not feel comfortable reaching out to somebody, but if they see it, they can reach out to you. So there's a lot of things here that you guys should know that you've got pretty much a team of people for me, 24 hours a day working on this, working on your issues. But you've got a team of people who are at the PTC, who are, frontline TAs who are working with you guys to try to make sure that you guys are lean and mean through this process too. So let me know what I can do to help. And I'm going to check a couple other message sources before I get kicked off of this call. Let's see. Nope, that has nothing to do with Eaglesoft. But let me know. Let's see. Tanya wrote something. Where is it? Okay. Somehow or another, I guess because I have the chat open, I'm getting messages slower than possible. Okay, so yeah, I'll answer that in a second. Yeah, so anything else that you guys can think of? We got 5 minutes before we dump out of here. And I said it earlier, I'll say it again. I'm going to try to set up a Zoom call tomorrow where I'll be able to actually show you on Eaglesoft some of the things that we talked about today, some of the cleanup processes, some of the things that I was talking about with setting up your employers properly, your insurance companies properly. I'll try to set up a Zoom call tomorrow around the same time. I have to look at my schedule to double check and make sure it's okay. But I'll try to set up a time where we can actually do kind of a hands-on Eaglesoft question. But happy to help. And let's see, does anybody else have anything else? Doesn't look like it. Trying to give you a minute before I have to get off. And do me, I'm going to actually, now I won't even say it. I'll just post it in the Facebook group. But if you guys have anything that's going on that I can help with, let me know. Look back through the chat string on some of the things that we talked about, some of the links that are there. There's some great links that came up during this whole process. We'll like to see the steps for emailing x-rays when we upgraded Windows. Okay, so I guess the question Valerie is asking is, you upgraded to Windows 10 and somehow or another you lost the connection between Outlook sending emails directly out. So there's a few threads in the Facebook group that address that. That's something I would call PTC, or actually, if you have an IT guy, sorry to put it that way, generically, an IT guy, have them in your office, call a PTC and work together. It could be your version of Outlook. It could be could be some permissions. There's other ways you can do that. You could even download Mozilla Firebird, not Thunderbird, Mozilla Thunderbird to be able to email x-rays. So there's a couple of different workarounds. A lot of it depends on your particular setup, what version of Windows you have, what version of Outlook you have. Do you have it as Outlook 365? Do you have it as Outlook as a desktop program? So you have to be aware of different versions before you can get a real answer to what's going on. There's too many options for me to know, and I am not an IT person. I'm but I'm not an IT guy. So hopefully that'll help. But yeah, that's an annoyance. So let's see. 2 other messages that came in. Let me just double check what they are before I let you guys go. Got 3 minutes. Perfect. Yep. You're welcome. Happy to help. And I'll say this one more time before I get cut off. Please just be very aware of some of the sales pitches that are coming around. If you guys ever get messaged from somebody in the group trying to sell you something, please let me know. I've had to kick 2 people out of the group over the last 2 days because they were posting, things about you buying stuff from them. So Lester made it before I close. I'm glad you got in. Hopefully things are okay there, Guy, and hopefully I can help with whatever's going on there, but I'm glad you made it in. Every time I see his profile photo, I have to smile because I know that speedometer very well. So I'm glad you're in. Let me know. And yeah, I'm glad Diana put the PTC number up there. So 800-475-5036. It's terrible. I know that number better than I know my own phone number. So 800-475-5036. Give them a call. They're there to support you. If you are not on support, if there was ever a time to realize that support is something that you need, this is it. So let me know what I can do. Let the PTC know what they can do, and we are working as closely as possible together to try to make sure that we can answer any questions that you guys have. And I've got to go because my call will start ringing through soon, and I need to be on that. So thanks, guys. Thanks for being part of this group. I love you, fielders. Thank you for everything that you're doing. Thank you for all the stuff that you guys are going through. Believe me, I feel for you, but let me know what I can do to help. So thanks, guys. Talk to you soon.